deformity. Using bidigital palpation, both the maxillary and mandibular lips will be rolled between the clinician's fingers to feel for thickness or masses.
Oh no, she's good.
The lips are then retracted, which can be done either using fingers, a mouth mirror, or a tongue depressor. And the following structures are observed and inspected: maxillary and labial mucosa and alveolar mucosa, mandibular labial mucosa, alveolar mucosa, mucobuccal folds, and labial farina. Both sides of the mouth are retracted at one time to observe and inspect the following: buccal mucosa and parotid gland papilla, maxillary vestibule, and mandibular vestibule. The client is then instructed to raise the tongue to the roof of their mouth. The client will inspect the area for any abnormalities. Then she will use bimanual palpation to palpate the floor of the mouth to feel for any thickness or masses. Next, the clinician will take a damp 2x2 gauze Next, the clinician will instruct the client to stick her tongue out, and using the gauze will pull the tongue out and look at the lateral borders of the tongue.
Just make sure that you have the right expectations for it. And you're right, it is there to help your posture.
She will also observe the foliate, circumvallate, filiform, and fungiform papilla on the dorsal surface. She will palpate the lateral borders using digital and, if necessary, bidigital palpation. She will then remove the gauze to observe, inspect, and palpate the anterior portion of the tongue. Next, using the dental mouth mirror, she will reflect light onto the hard palate for visual inspection, observation, and then she will palpate digitally with on-off pressure across the entire hard palate.
Move your chin down and try to yeah, so just tuck your chin down and look over the telescope.
The clinician will then grab her hand mirror and instruct the client to say ah. Say ah. While the clinician depresses the middle third of the tongue with the mouth mirror to inspect the soft palate, tonsillar region, and oropharynx areas.